Good morning, everyone. I'm Dr. Mandal. I am a consultant hematologist working in the NHS, and today I wanted to talk to you about the huge topic of anemia. The reason I chose this topic is that majority of the population will have had problems with anemia at some point in their lives. That is because a huge number of conditions, directly or indirectly, can cause anemia. Now, what is anemia? Anemia is simply the term given to a lack of red cells. That in turn causes a lack of hemoglobin in the body because the main function of the red cells is to carry oxygen via their hemoglobin molecule and circulate the oxygen in the body so that the body is able to perform its functions. So when there is a lack of red cells or lack of hemoglobin, it diminishes the body's capacity to carry oxygen around, and that is perceived clinically as anemia. And symptomatically, it will make you feel tired and lethargic, which is the top symptom of anemia. So what causes anemia? There are many things that cause anemia, and that is why it is so common. Simple things from an iron deficiency or a B12 or folic acid deficiency can cause anemia. Other health conditions can cause anemia, for example, heart conditions, arthritis, kidney conditions, liver conditions. All of these can cause anemia. So other chronic diseases can cause anemia. There are disorders of the hemoglobin. There are disorders of the red cell membrane or red cell enzymes, which some people are born with. And so there is an entity called inherited anemia as well. And sometimes it's not a problem with the blood or the bone marrow itself where all the cells are made. It can be a problem elsewhere which can cause anemia without it being a predominant problem of the blood itself. So for example, other conditions, even sinister conditions such as a cancer diagnosis, can cause anemia. And indeed, there are some situations where the body develops antibodies, as in other autoimmune conditions or as a disorder of someone's immunity, where the body can develop antibodies against the red cells and cause the red cells to break down. So there are all these different mechanisms by which one can become anemic. Now, what are the symptoms of anemia? As I mentioned before, the top symptom is that of feeling tired and fatigued. Apart from that, one can get headaches, one can get dizziness, visual problems. Sometimes there can be obvious bleeding, which can cause anemia, and as well as other features as well. For example, if someone has got a background of a heart condition, then one can get chest pains as well, breathlessness, and all those things as a result of anemia as well. So how do we treat anemia? Well, because the anemia can happen from all these different conditions, there is no one treatment. We first have to find out what is the cause of anemia and then treat it accordingly. If it is something simple like an iron or a B12 or folic acid deficiency, replacement of that can cure the anemia. It can recur later on as well, in which case we have to do repeat courses of the treatment. In other situations, if the anemia is caused by something else underlying, then it may be treatment of that underlying condition that can resolve the anemia. And indeed, in situations where anemia is caused by other chronic diseases, it is treatment of that underlying chronic condition and controlling it that will give the best outcome for the anemia itself. So that's a very short and brief overview of anemia. If you have been told that you have anemia and you need any help, then please feel free to contact us. Thank you.